Welcome back to this week's episode of Promising Young Surgeon. I'm your host, Dr. Frances May Harden, and today we are talking all about starting over as many times as you need to, in any way that you want. I am so excited to have Dr. Tosin Odunsi joining us. Her story is a powerful reminder that there's no one way or right way to live a fulfilling, beautiful life. And it's not just a physician's only problem. So many of us struggle with carving out unique paths in our careers. Taking time off, switching to a new industry, all of it can be very daunting, and certainly it's the road less traveled. So I really admire those who embrace change and bravely share their stories about that, as well as the lessons that they learn from their experiences. So without further ado, allow me to introduce our exciting guest today. Dr. Tosin Odunsi is an OB GYN who earned her bachelor's degree from Cornell University, master's in public health from Thomas Jefferson University in Pennsylvania, and her doctor of medicine from Meharry Medical College in Tennessee. Dr. Odunsi completed her residency in OB GYN at Danbury Hospital in Connecticut, followed by fellowship training in minimally invasive and robotic surgery in gynecology and reproductive surgery in Georgia. She founded the Mentorship Squad, an initiative that supports Black and Latina women on their path to becoming U.S. physicians, underscoring her commitment to making healthcare more inclusive. Her expertise extends to published works in the field, and her insights into women's health have been recognized in a variety of major publications, including Essence and Pop Sugar. Dr. Odunsi, thank you so much for joining me today. I cannot wait for everyone to kind of hear your story and get to know you. It's really been a joy for me personally to learn from you, but I want to, as part of your introduction here, just start with a big picture question. Like, you've lived a lot of lives. I like calling you a Renaissance woman. That's like such an extreme compliment. We don't have a lot of Renaissance people anymore, but I do view you as someone who can be this like jack of all trades. So can you please, in your own words, kind of walk us through your journey over the past few decades, the many different lives that you've lived, and what brought you here?
Thank you. And thank you for that intro. It's always interesting hearing what I've done. But I think this journey starts from when I was 3 years old. I always wanted to be a doctor, didn't want to be anything else. And then I did, quote unquote, everything right. And I think in every story, there are points where we reflect on where we are and maybe have to pivot. So there are several points in this story where I did have to do that. And I learned a lot about myself and my strength, my resilience, my grit, all those things. So I always wanted to be a physician. As the intro said, I went to Meharry Medical College and also went to Cornell University for undergrad. And I struggled a lot in college with the pre-medical coursework, but everything was fine. I got into medical school and had gotten married right out of college. So maybe that's a point of like a major point where I was 21 years old, newlywed, and started working on my master's in public health while I was applying to medical school. And then did okay in medical school and really struggled with the board exams where I had to repeat them, take them again. And I didn't think I was going to match. And I'm an obstetric and gynecology physician. And taking those exams over and over again, that built my grit, that built my resilience, and it built my confidence in my ability to keep failing forward and pushing forward. So now we finished medical school. I finished my master's in public health. It did take me 5 years to finish medical school, to take all the exams, get that degree. And then I hit residency. And my last week of my first year as an intern, that's when my husband passed away. So I will say that is actually the pivot point. That's the
I'm so
biggest
sorry.
experience. Thank you. That was the biggest experience I've ever had in my life, and that's to date. And that happened in 2015, almost 9 years ago. And when I reflect back on that time, I just remember this woman who all of her identity was in medicine. All of her identity was in being a wife. So it forced me during the grieving process to take a step back and say, who am I without any titles, without any fluff, without being all these titles to other people? Who is Tosin? And I think that the past 9 years has been a journey to discovering myself and discovering what I believe in, what my core values are, who I am without those other roles. And that's why we're here now, because it's a beautiful thing to be able to take a step back and say, I'm enough just the way that I am, and just with Tosin.
Absolutely. I mean, again, and I get goosebumps hearing you talk about everything that you've lived through. And I just can't, like I said, my heart goes out to you for your loss, and your strength is honestly incomprehensible to me. But how highly I think of you for it. Um,
Yeah.
and I think that people like you help us all to, hopefully, the goal being like that we can also do that important work, like that identity finding, soul searching, important work. Because, especially when we talk to like young physicians or like young professionals at all, don't make work your whole life. Your career will never, it's not going to be with you forever the way that you're going to be with you forever. So I encourage people to kind of grapple with these bigger pictures.
Yeah, I completely agree.
Wonderful. I just wanted to say that one thing that really resonated with me was you even saying that, like, even as a kid and a very driven, high achieving kid, like, you did everything right. And that is such a common theme, I think, for a lot of us, like disillusioned professionals, whether physicians or not. But I mean, like, a lot of disillusioned surgeons that I know, they're like, I did everything right.
Mhm.
So when things really do hit the fan professionally in some way, whether it's like in their practice or, at the training level, it can be like so earth shattering.
Right. And I have this conversation as well with mentees when they're coming straight out of residency. It's almost like okay, I don't know who I am, but the only thing I know is how to work, and to kind of not think for myself and just dive into working and not figuring out what do I even want in a job as an attending? What are my non-negotiables? What's the value that I bring, and what am I looking for? And do I see myself as someone who can add value to this field versus kind of like a cog in a wheel, which is a common feeling, especially amongst women in medicine, that, okay, I'm going to work and then I have all these other responsibilities. It can lead to burnout pretty quickly.
Yeah, I think that's such a major point, is deciding beforehand. There's, if you like being a cog in a wheel, absolutely, like, go nuts. I don't judge that at all. But what drives me up a wall, right, is when there are these young physicians who come out of training, they're fresh on the scene, they're taking an attending job, they just don't know they're going to be a cog in the wheel. Like,
Hmm.
that's frustrating. So now they go into this situation, they only realize it maybe years later. Maybe they never realize it, but they realize it years later as the burnout is starting to take a toll, whether on their mental or physical health.
Right.
In terms of, retaking board exams and things like that, what advice do you have for people who are going through that today? Because that's, it's not uncommon, but it's rarely spoken about.
I think that's a good point. So people don't talk about it. There's a lot of guilt and shame if you are not perfect. And I've had lots of comments about my competency as an OBGYN, and oh, the light just went out, but that's all right. About whether I'm good at my job. I don't respond to those people because I know what it took to get here, and I am board certified. So as long, it doesn't matter how many times you have to repeat those exams. I don't believe those exams indicate the type of physician you're going to be. There are people who have difficulties that kind of get unmasked as they become older. And one thing that I've learned is There are a lot of people who get diagnosed with either learning disabilities later in life
Hmm.
or neurodivergency. So that was the issue, or one of the factors in my case, where it was 2 years ago when I was 35, I got diagnosed with ADHD. And that gave me a whole lot of answers to why I struggled so much. I was in the typical environment of lecture style and was doing the best that I could, but it had nothing to do with my intelligence. So when people make comments like that about failure, it's not hurtful to me. It's hurtful to those people who see the comments
Yeah.
and think, wow, I cannot share. I can't show any form of weakness. And am I dumb? Am I not intelligent? And I tell them, if you got to this point, it's not a matter of intelligence. It's a matter of figuring out, how do you best learn? How do you retain information? And you have everything within yourself to succeed. So I don't subscribe to, you failed and then you give up. You fail and then you stop. You fail and then you don't keep going. I subscribe to, okay, I failed. Let me do it again until I'm physically taken out of the room or taken out the door. The door is not shut for that person.
That's incredible. I can relate to the importance of learning and teaching styles because that is one of the obstacles that I really ran up to in residency. Like that, that's where it kind of came to a head for me, just because I remember kind of saying at different points, whether in a PD meeting type of setting or something like that, just saying, I know myself a bit. I didn't know myself very well. I was kind of like a prototypical surgical resident, I would say. But I knew, because I was like looking around me, I was taking assessment of like what I was learning every year. And I just said, I don't learn very well when I'm afraid. So
Correct.
like if somebody is screaming or somebody's like, doing the intimidation, the bullying, the insults, the silent treatment, any of it, like I don't personally learn well in that environment. Again, kudos to anyone who does. Some people do learn in that environment, but it can be so tough during this whole journey of medical training, which of course, I mean, it even starts as a pre-med. You make the commitment then. And in medical school and in residency and in fellowship and beyond, it can be really difficult when you are a intelligent person. Because I fully agree with you philosophically. I think every person who comes to the table in this scenario, yeah, they're intelligent. It's not really a question of that. And so it's funny too, because I feel like the model that you're describing, the way that you approach it, almost opens up the door for people to be like, let's say that there's a bright medical student, there's a bright resident. This person is not succeeding though. Like they are having difficulty doing X or Y or Z requirements per training or per the curriculum. I am interested in the question, which is like, how could we be teaching this person better? Not how can we womp them into maybe conforming to something else or trying to brute force it or things like that.
Mhm.
It's like, how can we meet them in a new third place?
I completely agree. And that experience in residency changed the way that I approach teaching and leadership, where even just this past 1 or 2 weeks, there was a struggling medical student. And within that first shift, I said, I wonder if they have ADHD. And I, as the attending, was very transparent about my difficulties and my journey, and had a conversation, just sitting down, not intimidating, a safe space. And I didn't feel like residency was a safe space for me. So moving forward, I create a safe space for residents and medical students because I don't want anybody else to feel that way. So the student ended up sharing that they just got diagnosed with ADHD not too long ago. That conversation would have never happened back when I was in medical school because nobody was talking about it. So I think our generation of physicians, we have the responsibility of, we're not that far from residency and we know the experiences. And frankly, it doesn't make sense. The setup of residency doesn't make sense to me logically, where we're exhausted. Our hours are insane, and we're expected to perform when we're not fully functional, and it just doesn't make sense. And I don't think we prioritize self-care enough. I don't think we prioritize different ways of learning. So moving forward, I decided I'm not subscribing to that. I'm not doing that. I'm not doing that bullying and all of those tactics that didn't work for me. And it was very difficult for me to retain information because I was always scared.
Yep, that's very real, and I love that you're creating a different kind of culture for your learners. That's that's like, so I think they'll never they'll never even know, I think, probably the full value of what you're giving them, because hopefully they don't have like some really traumatic experience to
Mhm.
compare it to. But I definitely applaud what you're doing. And I agree that our generation is hopefully moving things in the right direction and can do as good a job as possible to open up these conversations. I do want to call back to, you mentioned like some of the negative comments, like people who just don't get it. It is frustrating. It's frustrating. I 100% believe you, because I know there are people out there who don't get it. But the people who are like, oh, okay, well, like, are you competent? Like, it sounds like, it took multiple, rounds of this test for you to get where you are. I want to ask, what positive feedback have you received? And I would imagine like support for everything that you've shared about your journey, like people connecting with you over it, wanting to engage with you because of it.
I think there are two areas that I see this benefit of being transparent about my journey. Number one, with my mentees, where they don't feel like a failure is going to kind of do them in. They don't feel like it's an all or nothing thing. They're able to see who they are as a whole. And then when I'm talking with them, it's very encouraging as opposed to prescribing a set thing that they have to do. So my mentees definitely feel safe talking to me. And that relationship has helped me too. It encourages me when I see them progressing despite those obstacles and those challenges. And then they're able to reach back once they get to the end, and I've seen that happen. So now I'm at the point where some of my older mentees are attendings, and
Wow.
it's
Wow.
amazing to see. It's like, oh my gosh, I remember this thing that happened to you or how much you were struggling, and they were able to get to the end. So now they're able to multiply that effect, which is amazing. The second thing that I see is with patients, where specifically with this job, patients pretty much every week, whenever I have a new patient and I take the time to explain things to them and validate their concerns, validate their pain. Even in this past week, I had two patients crying, and it's not my intent to make patients cry, but if a grown adult has that type of response about their OBGYN care, I can only imagine what type of response patients would have if we all did that. If we all took the time to explain, if we took a step back from, gosh, I got to get through all of these patients, I got charting to do, I need to argue with insurance companies. I think if we took time to see our patients as human beings versus kind of objects, the patients will feel that. Whether we have 15 minutes or 30 minutes, they really sense that genuine care about them, and that's that human touch. And I think in the medical field, we've lost that a little bit, where patients feel scared. They don't trust us as much as before. And that's because of misinformation and also other things floating around. But if you can make that human connection with the patient, I think that's incredible. And every week, and that's what gets me up in the morning, and that's why I really love what I do. I love my job. Having patients say, "You're the first physician that listened to me. You're the first physician who explained even simple concepts like what the anatomy of my body, or explaining why I'm doing certain tests, explaining procedures before I do them." or having patient education videos for them, that extra step makes the patient physician relationship so much better. And it's amazing to go to work every day and do this. I love my job.
Your patients are lucky to have you.
Thank
I
you.
do think that I agree with this connection component, but it is interesting because it's kind of linked to, like, let's say the old quote, right? Like, a person can only meet you as much as they've met themselves. And so you know yourself really well. I would say know yourself much better than the average physician knows themselves. And that that comes across in your interactions with your learners, with your patients, things like that. This is part of the reason why I really do think that, like, the physician workforce, like, the healthier that we can be, the more that we can know ourselves, like, have identities, that does contribute to then presence in real life, which also contributes to improved patient interactions and, like, therefore, better care. So I really do think that those things are all connected. But to me, one of the reasons for disconnect is, like, I mean, like I kind of alluded to earlier, I know physicians where their primary mode of communication is like intimidation or, you know, just various bad vibes types of things that they bring to the table. So, of course, like, their patients don't always feel like exuded warmth or presence from them. I will definitely echo your sentiments, and I'll use the example of I was taking someone for revision sinus surgery recently. And, this is not their first sinus surgery. They literally had sinus surgery a few years ago. So, of course, we're like doing the full informed consent in clinic. Like, I'm pretty thorough. I care a lot about, like, this pre-op discussion, the risks and benefits, like what you're talking about, just discussing everything like really thoroughly. And I even said, I was like, absolutely, let me do my spiel. At the end of my spiel, I was like, you may have heard some of this before. Like, I know it's not your first rodeo. I tell patients that all the time. Okay, I know it's not your first rodeo. And they were like, no, I have not heard any of this before. I was like, hmm? And they were like, the doctor told me that I needed my sinuses cleaned out. And that was the entire conversation. Then I got put to sleep a week later.
Oh, wow.
And it's like, because I was like, well, I mean, like, the risks to the eye and the skull base, like, those are, I mean, bleeding, like, risks of bleeding, infection, damage to adjacent structures. Let's just go at that simple.
Right. The
They were like,
basic stuff.
no, they were like, didn't hear any of this. Like, literally, I was just told they need a scraping. I received a scraping. And I do think that patients are very appreciative. And I know myself as a patient for my loved ones, like, yeah, I want to hear, it all. I want to hear the risks and benefits. I try to have that conversation with them as if they are my own family. And it doesn't take a huge stretch of the imagination for me to do that. But I do try to consciously work on these skills, including, like, presence, my ability to be very present, very with you, very thorough in our time together, physician and patient.
Right. That's awesome. I love to hear that.
One thing that, I wanted to even call back to that kind of haunts me, you pointed out how residency doesn't make sense, right? I think that, yes, like, I cannot say that probably enough. But what's interesting is this, because you talk about, like, it's the super sleep deprived, way overworked, quite strung out resident. And the thing is that I love this joke. If you heard of SEO, like, people talk a lot about SEO in digital marketing and things like that. It's like search engine optimization, because people are always trying to, like, get themselves up as a higher Google hit and things like that. But the joke that some people will make is, when we look at systems like this, is somebody else's optimization.
Mm.
Because absolutely, residency makes no sense for residents. It makes no sense for, like, a certain type of person. But guess who it makes perfect sense for? If you think about it from the hospital standpoint, from a nearly free labor, great deal on labor standpoint, like, it makes a ton of sense
Mm-hmm.
then, and it's optimized, just optimized for somebody else.
Yeah.
And it's crazy because we are so far from the system that would be more ideal where it's optimized for the resident, for the learner, for the future like physician. We're trying to invest in our physicians and keep our physicians in medicine, things like that.
It's funny you mentioned that. So my graduating grand rounds was about um, pretty much physician burnout and ways to decrease burnout. And there's a survey at the end of our yearly exam, our in-service exam, and they're pretty much asking for input in terms of what would you like out of residency? What are the things that are important for you to get? And the data showed that OB/GYN residents just want to do regular 9 to 5 things like go to the doctor, go to the dentist, get their car maintenance done, things that occur typically before sign out and things that are in the daylight hours. So it's such a simple thing. It's not about having like a wellness week or wellness activities. It's just regular everyday things. I think that would boost the morale. It would decrease burnout. It would also decrease like seeing patients as objects and being able to humanize medicine again. So I think it's just interesting that we're still kind of doing the same things and not getting to the root cause, which is we just want to live like normal human beings and not be treated like robots. So we have a long way to go, for sure.
Yeah, and I wonder, I mean, like something that comes to mind for me when we start to brainstorm or kick around ideas like this is like, what if every resident had a half day per month that was like the flex half day? That
Mhm.
seems not too onerous. Like, is that, is something like that reasonable? I mean, they probably don't need a half day a week to like knock out all
Yeah,
that stuff, although that would be nice. But like, the protected half day per month.
I think
Errands,
that's very
doctors.
reasonable. Very reasonable. It's more of trying to squeeze out everything out of the resident. Um, so if a program really cares about the residents, sure, they'll probably do that. But I think that's a very reasonable accommodation.
Yeah, like a proposition. But you're right. I mean, they are trying to squeeze everything out of residents. They are kind of succeeding, which is why we are getting husks of people entering the physician workforce. So, I do want to kind of change tack a little bit because you've done so much and I want to make sure that we hit on some of these important areas. But your OB/GYN career has spanned several states including Washington, Georgia, Florida, and Illinois. And I'd love to hear more about your diverse experiences in multiple, care models and like which ones were more optimal. How can
Mhm.
equitable healthcare look?
That's a good point. So I came out of residency questioning if I wanted to do clinical medicine. And I gave myself 3 to 6 months to decide if I wanted to do medicine. So I ended up taking, I think it was 4 months off after residency just to reflect on what just happened. What was that experience? It did take me 5 years to finish residency because of the grief and taking my exams over again. But it really boiled down to I want to reclaim my time and my autonomy and have full control over my life. And I think that's an important question to ask. What do I want my life to look like? So I literally wrote down I don't want to be contracted to any shifts per month. And that was the contract that I
Wow.
signed in Washington State. And it was beautiful. And I really loved that experience. I went to work, I could flex up the shifts that I did. I was
Yes.
very curious. Like, I was that medical student again that was very excited about what I was doing. And then I decided, okay, let me try for fellowship. Let me get additional surgical training,
Mhm.
and I went to Atlanta for my fellowship. And I fell in love with things that I was passionate about before. So endometriosis, fibroid treatment and management, and just the art of surgery and things that kind of were pushed down during residency. I
Mhm.
always loved operating, but it really came out during fellowship and going to these different hospitals, things that I just forgot about. So going to these different states as a locum. So I was a contracted worker
Mhm.
in Florida, and now, or when I moved to Chicago, I was doing locums here too. What I saw was how medicine could be, and then
Mhm.
also some things that I didn't like. So it helped me to narrow down what I was looking for if I should sign on permanently with a
Mhm.
hospital. And some of the things that I learned is that you have to always be curious. And that curiosity helps you update your skill set. It helps you better educate patients. And it helped me understand some of those obstacles that we as physicians might have, whether it's lack of resources, maybe lack of backup. There was
Right.
one evening where I was at a site for my locums gig, and I was in the OR from 11 p.m. until like 7:30 in the morning, just straight back to back cases, and there was no backup. So being in that situation, I learned, oh man, people are practicing without having help and support. And when you don't have that help and support, that gets to be dangerous. Okay. So having safety measures, having things in place to support the physician
Mhm.
ultimately results in giving patients the excellent care that they deserve. So that's something that I saw that I didn't like. So now in my current job, I'm like, okay, we have to have, or before even signing for this job, what are the safety measures? What are the things in place to help us help our patients as best as possible?
That's great. I mean, I do think that inherently you had this willingness to, yes, one, be curious, and then two, kind of like look around and experience different things to figure out what you wanted. And that really is rare. It's certainly rare in medicine because most people feel like, okay, I'm out of residency. I got to like lock it down. I'm going to just stay in one spot and I guess maybe even operate there for like 20 years, which is funny because it's a little bit of a misnomer. Like I've seen stats like 80% of ENTs leave their first attending job after 2 years. Like, so, I mean, it's kind of like a fantasy, but yes, the resident fantasy is okay, I'm going to go and, I'm going to build up my practice. But I love that you did something that definitely makes a lot of sense. Honestly, I think more of us would benefit from something like that, getting to try out different models. That's how you figure out your non negotiables, like you said. And then that's how you maybe make the long term best decision for yourself. But it's so interesting because the system doesn't it's not naturally set up to make that really easy on people. And
Mhm.
it is set up a little bit to make people afraid of that. So I guess
Yeah.
did you have any fear going into that? Is there any advice you have for someone who's like, "Man, that sounds cool." Like they're hearing how you did it and they're like, "That's very cool." Like I don't know that I'm bold enough to try it like that with all the unknown, the multiple changes.
I think it boils down to just deciding. And I know I say just deciding as if it's not a big deal, but you have to kind of set your mind and keep it set that no matter what, I'm going to have blinders on to all the noise, all the distractions, all the people who want to tell me how my life should be. And again, it takes introspection, and medicine is very busy where you can think that you're making progress, think that you're growing, but true maturity is the ability to take a step back and say, what do I want? What do I want out of this life? Is it just to get to the next quarter? Is it to get to next year? I want to, or maybe more so now, I look to the future, not too far in the future because of my history that anything can happen at any time, but just taking a step back and saying, what do I really want out of this life? And I think what's special about what I did is I gave myself permission to do that. And I gave myself permission to, yeah, find myself and pick and choose what I liked from each facility. So, to that person who is a young attending, and for me, a young attending is someone who's maybe 5 years out of residency. I've also had conversations with older attendings who maybe they've been in practice for 20, 30, 40 years, and they saw me, this young attending fresh out of residency, doing locums, and they're like, well, isn't that for like when you're doing retirement or when you're about to retire? I don't think so. I think it lets you do clinical medicine and also rest. It lets you take back that control over your life. So to that person who this sounds attractive to, give it a shot. You have nothing to lose. And with locums, what's beautiful is you aren't signed there for the rest of your life. And I don't sign contracts that are multiple years long because life changes, life happens, we go through different transitions, and I don't want to be locked into something.
Yeah.
I have trust issues, so I don't want to be locked into a certain job before I even try it out. So the job that I got, the permanent job I'm at now, it came out of a locums job.
Mm-hmm.
So locums provided a window for me to get the setup that I always dreamed of, that I always wanted in terms of my hours and being able to spend time with my family, go on vacation, all the things that I feel like I'm catching up on now. So it's been great.
Oh, that's awesome. Yeah. I mean, I love that for you. And I love just the fact that you have found these answers for yourself. To me, the big three questions are, and this comes out of like kind of corn fairy teaching. Number one, what do you want out of life? Number two, why do you want it? And number three, what are you willing to do or not do to get it? And I think, I heard those questions for the first time about a year ago, and it really changed my life. And I wish I knew the answers to those sooner, because that, maybe some things would be different, but never too late, certainly. And so I think that really cuts to the heart of something that maybe is not talked about enough. One other pearl that I wanted to kind of glean from you is that, you know, the type of person who can take a setback like, not passing a board exam, something like that, or even just the fact that you didn't have the world's dream Disneyland residency experience, but now you're an attending. You give a very different type of experience to your learners. These are all like major things that you have just dealt with and then effectively moved past. And my question is, where do you get your motivation, your strength? Like, what role models do you have for that type of thing? Because again, it wasn't your residency role models per se that perhaps like led you down this path to what you've now carved out for yourself. But where does that come from?
Mm.
And how can
Yeah, so
more
I
or
will
less
say
access
that
that?
it takes you having maybe one or two people believing in you, and there were certainly advocates and supporters in residency, and I was well trained too. So when I went out as an attending, my first day as an attending, I was like, man, I actually know my stuff and I was adequately trained. So I wanted to make sure I said that my residency trained me well, and there were
Hmm.
people who supported me, were looking out for me, and made sure that I got to the finish line, which is the goal. Now, back to
Hmm.
the point of you just need one or two people to believe in you. If we go back to college, my pre-medical advisor, I didn't do that great my first semester or my first year of undergrad. And you go to your mentor, to your advisor, and kind of ask, okay, what can I do to do better? And how do I get to this endpoint? So she knew I wanted to become a physician, but she said I should pick something else. So it wasn't even any advice on how to repair my
Right.
GPA. My GPA at that time was a 2.7. Then I graduated, I think, with a 3.6. I worked my butt off.
Woo.
Yeah, I worked my butt off and made the dean's list and did everything I could to repair it. So I was a
Yeah.
competitive applicant, but if I had listened to her, maybe switched to a different career, I don't think I would have been happy because, like I said, I wanted to be a physician since I was 3. And there are a lot of people who are told yeah, don't do this, just switch. So you kind of have to have this focus again, have those blinders on, and decide, I'm going to do this thing. I will say, as a teenager in college, you haven't grown. You haven't gone through life. You don't have life experiences. So my parents, my sisters have been my constants in life. We've moved around a lot, but whenever it comes to anybody doubting our abilities, they have my back. They're the ones who are going to say, don't mind them. They don't know what they're talking about. And we do it for each other. And now I do that for my mentees. It's like, oh, don't even mind them. They're just saying stuff, like, just don't listen to them, tune out the noise. So it's very easy for me to motivate myself now because I've done the reps. So the more reps you can do, the faster you can fail. So I give myself 9 failures a day to, yeah, I'm just going to quickly get up and do the thing. On occasion, it takes me a little bit, but if you can get good at failing forward and failing fast and pivoting, that's where your strength is going to lie, because people don't execute things perfectly. If you look at successful people, they don't execute that thing that made them successful on the first go. It's a lot of trial and error. So for those people who are thinking, man, it's really hard. Yeah, life is really hard and it's not meant to be easy, but it gets easier to manage the more reps you do. The more reps in failing, the more reps in trying something hard, the more reps in challenging yourself. And it's okay if you are content and you found your thing and you're in your 20s, 30s. I have not arrived yet. I don't think I ever will. And having that curiosity, and yeah, I want to know so much about life, and I don't think I'll ever get to that point. And I'm always staying hungry. And that's the difference between a great physician and a good physician.
I'm with you. I don't think I'm going to get there either, to that point of being like, yeah, I'm good. I'm done. Cause I also, stay hungry, as you put it. Um, I think that that's incredible. And I just like to phrase it another way for people, right? Part of this is our perspective, the spin zone that we all do in our minds. Because what you're saying is so true. Like if somebody gets up every day and they say, I'm going to be perfect, my expectation for myself is that I be perfect. If I fail, not acceptable. Okay, well, guess what? One day, if it's not every day, like most of us, then at least one day you are going to hit up to this wall of failure. So that is going to be in direct contradiction to your beliefs and the standards you hold for yourself. That is going to be like maybe a catastrophic existential crisis. Instead, think about the expectation that's like, I'm going to wake up, I'm going to do my best. Failing is absolutely a part of life. I am going to fail forward and I'm going to fail fast. And kind of like moving through that way, that's the agile person, like exactly what you're describing. And so I definitely, I say this as a reformed perfectionist. I mean, I did used to wake up and I was like, okay, it's going to be perfect. And we're just not going to tolerate failure. Well, guess what? That led to a host of bad days, and like bad places to go to mentally and physically. So I really do think it's about, like kind of to me, what you described is the equivalent of setting ourselves up for success. Like that's already beating the mental game, the mental portion of it. So, very related as you talk about like the many things that you still have to do in life and in your career. But I'm very excited about you just launched a YouTube show, a new creative endeavor. And so can you tell us like what led to this idea? What are some of the main messages that you're going to be sharing through it?
Sure. I've been on social media for a very long time. I used to have two Instagram handles. One where it was me talking about my doctor life or being in medical school, and the other was my personal. Then I merged the two in 2015 to become Life by Tosin. And this was a few months before my late husband passed away. And it really became my growth slash grieving slash wellness, everything lumped into one. And this past year, I've just had this sense of urgency to help other women and to help other women grow and do what I did, because we're just all out here doing the best that we can. And the past 9 years has really been instrumental in making me the woman that I am today. So I do want to help other women. It's called Unmasked with Tosin. And that's the little talks that I'm going to be doing on different topics, different things that we're going through. And the goal is to help you become better today than you were yesterday. And I didn't become the person I was overnight. Like I said, it took 9 years to get here. Could it have gone faster? Yes, absolutely. But I think sometimes we have to go through those growing pains to get to some sort of destination. So I'm excited for it. I'm going to be talking about personal development. I'll be talking about personal branding as well, because I think that's important. A lot of us, we kind of go out into the world and we're not advertising ourselves. We're not being loud about our value. We're not being loud about our abilities. And I think we do the world a disservice when we are not serving other people, when we're not helping other people learn what we've learned. So it's important for us to troubleshoot other people's struggles, and that's what I want to do. So I'm looking forward to it. I'm excited for everybody to join me on this new venture.
Awesome. Well, thank you for sharing that with us about your YouTube show. And I also have heard that you have a masterclass coming out soon. So can you tell us a little bit about that?
Yes, I'm very excited about it because we are inundated with coaches and people who are telling us, how do we do personal branding? And again, I want to cut out all the steps and get you to a transformation as quickly as possible. So if you've ever had questions about personal branding and how you can be, quote unquote, the product and also get paid and compensated for that, I'm going to teach you the key steps to doing that. So I'm looking forward to that, and it should be happening later this winter.
Awesome. Well, absolutely. I cannot wait to hear what you have to say, and I definitely want to learn from you. So, Tosin, thank you so much for being here. I'm, like I said, truly inspired by you and your career, and I'm grateful to you for joining me today on Promising Young Surgeon. Where can our listeners find and connect with you online?
Thank you for having me. If you want to find me, it's Life by Tosin, LifeByTosin on all platforms.
Wonderful. Follow me on Instagram at francismay.md and at Rethinking Residency. Visit my website, rethinkingresidency.com, to learn more about resident physician stories and ways that residents can most effectively navigate the game of residency. Thank you for tuning in to this episode of Promising Young Surgeon. If you enjoyed this episode, please subscribe, rate, and leave us a review. And if you'd like to submit any questions for future episodes, email me at pys@heyinfluent.com.